Hey guys, do you work in emergency medicine? An absolutely crazy and intense environment where you see things every day that most people don't see once in their entire life? Are you feeling burned out, unappreciated, and like there's no one you can talk to about the things that you see every day and the struggles that you're having? Well, you're not alone. And I'm going to bring in a bunch of real professionals with real stories today that can relate to the stuff that you're seeing on a daily basis. I've struggled with burnout, I've struggled with discouragement, frustration many times, and I still struggle with it occasionally. My name's Aaron. I've been in emergency medicine for 15 years as an EMT, paramedic, and now working as an emergency medicine PA, and I'm the host of the Practical EMS podcast. We're going to bring in our guest today and have a great discussion that I hope you guys get some value from. How do you feel the transition from ER RN to ER nurse practitioner?
It is unfathomable. Like, you cannot understand what it's like. And I tell everybody this is going to sound really weird, but I think it seems like it's this great, easy job. And so if you don't love medicine, it's not going to fulfill you. I mean, it is easier on your body because I'm not doing all the pushing and pulling, less pee, less poop. But the mental demands.
More rectal exams.
Whoa, the amount of rectal exams.
That's the trade-off.
But there's only
that
poop in
you
one
don't
place.
realize.
That you guys deal with.
I'm Nurse Jellyfinger.
Yeah. If I read one more nurse note that says has black tarts. Oh, awesome. But I think that if you don't truly love medicine and don't want to practice it, it's probably not gonna benefit you, and the work that you do and the transition is just not gonna be enough. It was extremely hard. I tell students that I'm with or new people, I was an abused teen mom. That shit was easier. That was easier than those first 2 years. It is that hard and rough and kind of scary and so fast. Mm-hmm. I probably would not recommend going as a new grad into a level 1 like trauma center as big as ours. It's rough.
What did you find the hardest part?
I think just having to know so much of nothing. It's everything. And so the more you study, then you just don't see that. And then you just kind of keep seeing these rando things. I feel like I was blessed because I knew our docs, so I knew the group, but it was just the amount of medicine that you have to know and be spread from, 2 days to death was just a lot. And I don't know if I was clinically prepared enough. So
you have to be second best at every specialty.
That's what it is, right?
Like, you can't be an expert at anything, but you have to be like the second best at each specialty, which is really, really tough.
I think that's the most enjoyable part of the job too, is the fact that, you do have that spread of knowledge. Do you feel like as a nurse, you just kind of had the ability to rely on your doctors more than when you became an NP? You were the one they had to kind of look at.
There's that.
Yeah.
Like somebody always being there, but it's just the responsibility. Because as a nurse, I just was like, boom, this is what we're gonna need. I just already know. But as soon as you start thinking about everything and all their risk factors, their guidelines, you think of everything and all the differential diagnoses, that is just, it just flips the responsibility and makes it so much more intense.
Yeah.
Everything you hear today from myself and my guests is opinion only and doesn't represent any organizations or companies that any of us are affiliated with. The stories you hear have been modified to protect patient privacy, and any resemblance to real individuals is coincidental. This is for educational and entertainment purposes only and should not be taken as medical advice nor used to diagnose any medical or healthcare conditions.
It definitely sounds like the transition just from EMT to paramedic. I mean, it doesn't sound like as huge as like nurse to NP, but there's definitely a lot of that, now you're looking at the full aspect of the human body and what's going on with this person prior to treatments. And
I've said this before, I don't think there's that big a spread between the EMT and the paramedic here, though.
Which is nice.
But, because I've worked in some places where it was like this.
Maybe like an experienced EMT, right? Like an EMT who's been doing it a couple of years.
I mean, our EMTs here in this town are the most advanced I've ever seen.
Well, in the training process too, because I've talked to a lot of EMTs online and heard their different training processes at different agencies and different towns. And it's horrible, some of them. Like when I went through, it was like a 3-week academy, and I was like in a field training officer program for like 2 months.
Mhm.
And I mean, that's what I needed when I was an EMT. So I actually came out kind of knowing what I was doing.
Yeah.
But I don't know what the process is now, but I thought that was really helpful.
Yeah.
I definitely would say when it came from the transition from paramedic school, or like EMT to paramedic, I think being in this system helped out immensely because I went to a super accelerated paramedic program.
Yeah,
You know, I only went 12 weeks.
Yeah.
And that they're accelerated 12-week didactic, and that's all you did Monday through Friday was
All day.
learn paramedicine, you know, by fire hose. But I feel like being a paramedic or being an EMT within the system, definitely, as you said, spread wise, is a lot different.
And I think going to a program like that, if you didn't have that experience as an EMT,
Oh, it's
you wouldn't come out
No.
as a good paramedic.
No, you know, because asking a lot of those questions with the paramedics when I was an EMT and getting all, and then seeing even just scope of practice wise that is allowed here versus some other places too, allowed me to see a lot of different medications and learn about a lot of different medications from EMT to paramedic that, you know, in paramedic school, they're like, some places don't have this. And I'm like, well, my system carries that. My system carries that.
We do that procedure. We do this.
Yeah.
Hey guys, if you're interested in any of the products I'm using from First Form, I'll give you some links to those below. If you click on the links and buy their products, it will actually help support the show as they give us a little percentage if you use my link. If you want to support that show and use some awesome products, check out these links below. One thing that I've been using every day of First Form is their protein powder. A good high quality protein that your body can actually absorb is super important every day, especially after a hard workout. So check out the links below. They have a ton of flavors for protein. So I highly recommend First Form protein if you guys want to check it out and support the show at the same time.
So
It's helpful too to like, because when I was a brand new paramedic, it's hard to figure out like what's a BLS call and what's an ALS call. And I could be like, well, what did my paramedics do in the past? Like, oh, my paramedic would have attended this patient, or my paramedic would have let me attend this as an EMT. And so that's a really helpful like frame of reference too, to be like, well, what have I seen historically? Like, should I be attending this one? Should I be taking it more seriously? Because there's not really clear guidelines. I mean, obviously, if you're given medications or doing an advanced procedure, it's ALS. But I think a lot of times, like, kind of just need an advanced provider in the back to monitor and make sure things aren't going downhill, and kind of knows a little bit better what to look for. But
Yeah, I think the EMTs that we have here have they have the best diagnostic skills and the best. When they do their assessments, they do deep assessments. They don't do like a superficial assessment for the most part. And I think it's just because of the way we bring them up. And, you know, because, I mean, we were talking about Brian a little bit ago, and, you know, he worked up in Sioux Falls, and the EMTs don't do anything but drive. That's all they do.
I can imagine that.
And so the paramedics, they do all of the gee whiz stuff, and, you know, they start all the IVs, they do, you know, all of it, and all the paperwork.
yeah,
You know, and there's never a break for those guys. But
I think the transition between EMT and medic, I always tell people, is like, you don't understand the transition until you've been through it.
Correct.
Because like people are like, oh, it's just gonna be
That's how I
easy.
feel.
exactly.
And you're just like, no. It's
I
not. It's not quite so easy because you go from having kind of like as a nurse, you have like doctors and PAs above you who kind of tell you what to do. Like, yeah, you're independent, but you still have that
That comfort and that
comfort,
protection.
yeah. Versus, and then once you kind of transition out of that, and now you're a medic, you don't have that.
Yeah.
You're running. You can go in on a call first on if fire's not there, and you have a critical patient. You're having to work that arrest till fire's there with just you and your partner, and you're like, oh no, this is all on my shoulders.
100%. No, that is a great point, actually. I think, because I think when you're a confident EMT, like, it's great, you kind of know what you're going to do, but you always have that safety net on every call. Like, if you happen to not know what to do, maybe you do know what to do most of the time, but in that one call where you're totally lost, you still have a paramedic as a backup. You don't have anybody as a paramedic, and that's kind of one of the scary things I think about that transition.
But it's definitely one of those.
Hey guys, I'm going to jump in here. That's the end of this episode. If you got any value out of this today, if it resonated with you, if it encouraged you, the only thing I ask is that you subscribe to the show, and if you leave a 5-star rating and review, that is super helpful. I don't make any money from the podcast, and it does cost money to produce, so it's really helpful when you guys can subscribe to the show. It helps encourage me and keeps me doing this. You can also go to practicalems.com and check out all the videos and links there. There's also an EKG course if you want to financially support the show. and it's a pretty top-notch EKG course, if I do say so myself. So check it out there. You can also join my email list on practicalems.com and get notified of every episode release. You can also join my email list at practicalems.com and get notified of every time we release a new episode. So check it out there, guys, if you want to support the show. And thanks for checking this one out, and we'll see you on the next one.